PFAS, the Forever Chemicals, presented by Brookline Mothers Out Front and the Brookline Department of Public Health and Human Services. My name is Louise Bowditch. I'm a member of Brookline Mothers Out Front, which works to create a healthy climate and a livable world for the future of all our children. Our keynote this evening will be followed by remarks from Sigalle Reiss, Director of the Brookline Department of Public Health, and Alisa, Jonas, Chair of the Brookline Moderators Committee on PFAS. Following these remarks, we'll have time for questions. So please submit your questions using the Q&A function on your computer, not the chat function. Thank you for remembering that. When you want to ask questions, the Q&A.
Recognized that PFOA was toxic. So what happened? So PFOA was replaced. It was replaced with PFAS. 8 carbons again, slightly different chemical. It was thought to be less toxic. In fact, it's not less toxic. So we have this replacement. We also call this a regrettable substitution. Industry moves much faster than academic scientists who study this stuff and much faster than regulatory authorities. Our study tools don't allow us to keep up with the industrial manufacture of these chemicals. We went from PFOA to PFAS to 6 others, and now we've got over 12,000 in manufacture. So we have to recognize this, and we have to stop thinking about chemicals one at a time. We have to think about them as a group of chemicals. Some are harmful, we know that, because we have data. Most we don't have data for, but they're all persistent. We also know from a national study called the NHANES study that about 97% of people tested across this country have multiple PFAS in their blood. That includes you and me. This means 2 things. One is that we're exposed to more than PFOA and PFAS because we can measure those chemicals, but also that the trends in our blood reflect the manufacturing and use of PFAS. We also know that in communities that have heavily contaminated drinking water, which we'll discuss, that they have much higher levels in their blood than the national average. So how bad is PFAS for our health? Well, we learned a great deal about PFOA from the people in Parkersburg. Over the next 12 to 15 years, the evidence is clear. PFAS affect many organ systems in the fetus, in children, in adults. However, the most susceptible are the fetus and the children because their systems are rapidly developing. While several adverse health outcomes have been linked to PFAS exposure, two of the outcomes most strongly supported by the literature include immunotoxicity, in which individuals with greater serum levels of PFAS have been shown to mount a less robust immune response to vaccinations. We just came out of a pandemic, and there's a question about how responsive people were because of the presence of PFAS in their blood. And another is increased serum cholesterol, which puts individuals at greater risk of cardiovascular disease and metabolic disease, including obesity and diabetes. Yet most of the epidemiology and toxicology literature focus on fewer than a dozen or so of the PFAS, and much less is known about the thousands of others. The little data we do have mostly explains the effects of individual PFAS, yet we know people are usually exposed to mixtures of PFAS. As a population, we may be seeing the effects in health outcomes now. Elevated rates of reproductive effects in women, thyroid disease, increased cholesterol levels, and cancers. This is costly to people's well-being and to our society. So where does the PFAS come from that ends up in our blood? So on this slide, I'm showing what's called the life cycle of forever chemicals. Starting up in the left-hand corner with the manufacture of the PFAS that is used in consumer goods and firefighting foam. And because of the PFAS's mobility, it moves to the soil, into the water, is taken up into plants, into our food, into our drinking water. And there's an interconnection between the manufacture, the use, and the disposal and recycling through this system. It's essentially a closed system. We don't lose it. And remember, since the stuff doesn't break down, as we make more, we add more to the system. More in the system, higher exposure, more health outcomes. And this is reflected in the increasing level in organisms. So let's spend a little time on the water, since this has been such an issue here in the United States and actually globally. Wherever looked for, it's found. The major contamination source of the water is something called AFFF, or fluorinated firefighting foam, that contains a mixture of these PFAS. Think airports, fire training facilities, local firehouses, and DoD facilities. And another major source is directly out of the manufacturing stack, such as that which has been experienced in Merrimack, New Hampshire, with the emissions generated by the company Saint-Gobain. So in the United States, there is no federal drinking water standard. There are just guidelines for PFOA and PFAS. A few weeks ago, EPA proposed drinking water standards for 6 PFAS, and we shall see if these standards are actually promulgated. That means passed. Difference between a guideline and a standard: one is legally enforceable. There are fines if the standard is not met. A guideline is simply a please, pretty please meet this level. 5 years ago, the Massachusetts Department of Environmental Protection promulgated drinking water standards for 6 PFAS. These standards were derived with the intention of protecting the developing fetus. If you're interested to learn more about which communities have or had elevated PFAS, there's a link that I can provide to the moderators. And I will say that Massachusetts was out front with this standard. No other state had developed standards for 6 PFAS as a group, as a mixture, giving us the ability to recognize PFAS as a class of chemicals. So what are the major sources or ways that we're exposed to PFAS other than drinking water? Well, the left side of this slide shows the AFFF, right? And also the textiles. Remember, PFAS is beautiful at providing water resistance and stain resistance. So textiles are often coated with PFAS. In the middle panel, I show the water, the compost, and the fish, right, that weren't deliberately contaminated with PFAS, but because of their mobility, PFAS's mobility, those medium become contaminated through uses and waste products. On the right, I'm showing you that PFAS are also used in medical devices, semiconductors, and my group did an analysis to examine the pharmaceuticals that can be characterized as PFAS, including Lipitor, Prozac, Paxlovid, among hundreds of other prescribed pharmaceuticals. My point is that PFAS are useful in society, but they are persistent, mobile, and toxic, and they accumulate over time. So we have decisions to make. Do we continue to accumulate these as health effects are documented, or do we work to decrease their manufacture and use? On this slide, I'm raising the question of essentiality. This has been written in the literature, and it is now being raised by industries that are manufacturing PFAS. Do not throw the baby out with the bathwater. Do not ban all PFAS because some are essential. I've created this slide that reflects, sort of, in my opinion, from the less essential to the more essential. The left side has, should I care if PFAS be eliminated or not? Let me start again. I suggest that this definition needs discussion. It's essential. Is it essential that my sandwich is wrapped in paper that goes to the incinerator where it's burned, and the PFAS, where it enters the air, deposits on land, into plants and into the water? I suggest not. Is PFAS in my implanted medical device essential? Perhaps. But I suggest that if we are too lenient in our definition of essential, we will not actually innovate and make substitutions for these problematic chemicals. So, how do we limit or decrease our exposure? We have tools. We actually have two sets of tools. In fact, well, we have regulations and laws, and we have consumer choice. Regulations and laws, we've got some. We certainly have them at the federal level. In fact, EPA has all the tools it needs in the Toxic Substances Control Act, which was passed in 2016. EPA needs to regulate these chemicals as a class and not one at a time. So why don't they? The simple answer is money and power. These are very important products to commerce. Now, states can regulate. In fact, we've seen that Mass DEP has regulated PFAS in drinking water. DPH has provided advisories with regard to fish consumption and the presence of PFAS in freshwater fish in the state of Massachusetts. There are now two bills before the Massachusetts legislation called the Mass PFAS Act. It's a joint bill. There is a House bill and a Senate bill. That is a strong bill. It's called the Mass PFAS Act. That should be voted on this term. It does ban PFAS as a class and has exemptions for things like pharmaceuticals and implants. And the Senate bill also has a trust fund. And that trust fund is important because municipalities are going to need resources to fund the impacts of eliminating these PFAS. And there are local opportunities, such as boards of health, municipalities like Brookline through bylaws and regulations. So we do have tools to limit exposure and decrease use of these chemicals, but we also have consumer choice. And consumer choice has worked in other circumstances, but it takes many people to get on board. It means education and knowledge transfer, as you're doing this evening, and the committee in Brookline is doing. It also means reading labels. And remember, what is a PFAS? And definitions matter. One definition may include only the conventional PFAS, PFOA or PFAS. In that case, you may be purchasing a jacket that contains fluorinated carbons, but because there's no required specificity in the labeling, a company can state PFAS free when the product doesn't contain PFAS, but does contain other PFAS. What we'd like to see is fluoro free, right? So we want to address the carbon, the presence of the carbon fluorine forever chemicals. Municipalities can use their purchasing power and can also allocate resources to addressing the PFAS problem. And industries and businesses can change their practices and their purchasing choices. So together, the hammer, if you will, through regulation, and the carrot through choices that people are making can decrease and limit our exposure to these toxic chemicals. And so I think in the interest of time, I will hand this back over to the moderator. Thank you very much. And I do want to shout out to my two doctoral students, Emily Penoyer and Graylin Nielsen, who are working on the epidemiology and the toxicology, and my two colleagues, Jennifer Schlesinger and Tom Webster, who are also involved in this effort. So thank you very much.
Thank you so much, Dr. Heiger-Bernays. That was excellent. I would now like to introduce Sigalle Reiss, the director of the Brookline Department of Public Health and Human Services. She received her master's in public health from Boston University. It's a little closed loop here. She works on public policy and collaborates with local organizations to promote healthy communities. She also serves on many local and state committees. Sigalle?
Great, thank you, Louise, and thank you to Mothers Out Front for collaborating with us on this great effort. And of course, thank you to Professor Heiger-Bernays. We go way back all the way to BU School of Public Health, but also thrilled to say, a colleague in local public health in this effort. So very excited that we were able to host her here today. And I think sort of next steps, taking all that information, I definitely heard the collaboration of sort of governmental role in this, but also the consumer choice and how those things can work together to really have an impact. What I'm interested in is looking at how we can use our public health strategies to reduce exposure, the community exposure to all these to PFAS and to chemical levels in the community, and using the various strategies we have, which we're using right here, right now, with educating the public on what these chemicals are and where they are. And I think we're going to hear more about some local strategies that we're doing. So with that, we'll be able to answer in the Q&A specifically about Brookline. But before we do that, I do want to give an opportunity for Alisa Jonas, who's the chair of the Moderators Committee on PFAS, to just speak a little about some of the work that is going on in Brookline. And then we will also talk about some of the pending legislation that's coming too. Are you able to unmute?
Oh, hi. I thought I was coming after Sigalle, but let me get to the beginning of a PowerPoint that I'll put in here. Hold on.
Great, thank you.
Okay. So first of all, thank you so much for doing this forum. Our committee's been living PFAS for a while, and so I just wanted to show you all the members: Jesse Hefter, Anita Johnson, John Pergantis, Clint Richmond, and John Klaczynski, who is part of DPH. I'm going to now. There, does everyone see this?
No, not yet.
No, not yet. Hold on.
You need to share your screen.
Yeah. Ah, yeah. Wait. Yeah.
Are you sharing? No.
Ah, here we are. Thank you, Alisa. That's perfect. There you go. Back to the beginning. Excellent.
Oh, okay. Here I am. Just to give a little background, in spring of 2022, during that town meeting, there was a warrant article 22 called Fluorinated Chemicals Reduction Bylaw. And it was submitted by Clint Richmond, Claire Stamfer, and Deanne Cody. And it would have amended Article 8 of Brookline's Health and Public Safety bylaws by restricting the sale and distribution of products containing fluorinated hydrocarbons, specifically in the categories of cosmetics, personal care products, bulk packaged items, new nonstick cookware, fabric treatment products, and other items to be added by the select board over time. When this warrant article came before the advisory committee and later also during a discussion at town meeting, various concerns came up, primarily that many products contain PFAS, but they're, I think, as was discussed, they're not always listed on labels. And even if you contact manufacturers, there's lack of adequate information provided. And given those difficulties, it would be very hard for sellers to comply and for DPH to enforce the bylaw. So as a result, our committee was established, and we had as a charge to evaluate the feasibility of developing a workable bylaw restricting the sales of items containing PFAS. And as you can see, there were a variety of different elements to what we were to look at: how to identify non-labeled products, who should be responsible for that, what types of enforcement should there be, what kind of exemptions should this be funded, and hopefully if the state law passes, there will be some funding coming down. We're supposed to provide a preliminary report for the May 2023 annual town meeting, and then a final report for the November 23 town meeting with any warrant articles that we think might be appropriate. So during our first meeting, we decided that we wouldn't just look at the sale of consumer products. We thought we should also look at the town itself and what their practices are, and if we can give any recommendations for what town departments might want to do in the future. We also wanted to think about other educational opportunities. So when we thought about how do we figure out a good way to figure out how to restrict the sale of products that have PFAS, we said, well, let's see what other jurisdictions are doing. And it turns out that more than 30 states are considering or have already passed restrictions on products containing PFAS. They're across the board. Some deal just with sales, others with manufacturing and sales, others focus on purchases or uses, and that's especially so with municipal fire departments, where the foam often has PFAS and where the PPE includes PFAS. And in some states, they only require disclosures by manufacturers. We also saw that the regulations vary by product categories, and I've listed them here. Some of the same as were in our original warrant article proposed at town meeting. So just to give an example, Maine, as of January 23, bans all rugs and carpeting and fabric treatments that have PFAS. And as of January 2030, Maine is going to ban all products containing PFAS unless it is determined that it's unavoidable to have products that don't have PFAS and still function as they're intended to. They are working on a database of PFAS-free and PFAS-containing products. We thought, oh, wow, maybe that would be a good option we could use for guidance for sellers and for DPH. But it's a huge list of items and products, and then there's an equally long list of exemptions. So it just didn't seem like that database would really be helpful, at least at this point in time. As was just noted, in Massachusetts, we have a very comprehensive, one of the most comprehensive bills currently before the legislature. And it restricts the sale and manufacture of food packaging, children's products, cookware, fabric treatments, personal care products, rugs and carpets, upholstered furniture, child passenger restraints, really a broad brush. And by 2025, this would not go into effect until 2026 for some and 2030 for others. But by 2025, the law also requires the establishment of a publicly accessible database, which again might be something that could be used by Brookline to institute some form of bans. However, we did notice that we have not found any municipalities that have placed restrictions on the manufacture or sale of PFAS containing products. And I don't know definitively why, but I'm guessing it's the same reason that we have found it difficult to do in Brookline. It seems it's hard for a municipality to be able to implement this when we don't even have a good database that we can use. And our hope is that this will become easier to do once more states have implemented their bans. But we're still working on this. We started meeting with department heads. We're not done with that yet. The first one we met with was John Sullivan, the chief of the Brookline Fire Department. In Brookline, the practice has been to use non-PFAS foam for Class A fires, but PFAS containing foam is still to be used for Class B fires, but these are extremely rare and happen, I don't know, I don't remember the last time that happened, several years ago. However, because we met soon thereafter, the chief did locate funds to replace the foam containing PFAS with PFAS-free foam for Class B fires. So from now on, we will not be having foam with PFAS at the fire department. We do have storage of foam with PFAS, but it's very costly to eliminate. All municipalities that are currently eliminating PFAS foam are trying to eliminate the product, but it's hard to break down PFAS. And to the extent John Sullivan knew options, there's only one location in Canada that's currently the place where everyone is sending their PFAS foam to destroy the foam. In Brookline, we do still have personal protective gear that contains PFAS. Chief Sullivan said there are to date no approved replacements for PPE that have non-PFAS in them. We next spoke with Sasha Porter from the Brookline Schools Food Services, and they've been pretty impressive. They have worked very hard to eliminate the use of products containing PFAS. Their cookware is all aluminum. They have no nonstick cookware. Storage is in aluminum pans. Grab and go containers are all compostable. There are still some plastic dishes and silverware, though they're recyclable, but the plan is in the future to use solely dishes and silverware that are not plastic, but china. Finally, the last individual we've spoken with, though we still plan to meet with others, is David Geanakakis, who is the town's chief procurement officer, and he is responsible for purchasing products for the whole town. However, he had a similar refrain, which was that lacking any clear method to identify the presence of PFAS ingredients, it's difficult for the town to exclude such products from our purchasing procedures. We did some brainstorming about how we could identify some of these products. We thought of looking at the material safety data sheets for products that have them, for example, paint and sealants, and they might identify PFAS ingredients, or they might not. It wasn't yet clear to us. But again, the department heads would need training on which of the many ingredients that could potentially be PFAS, that they can be identified. The good news was that the town has a directive already in place that all cleaning products be Green Seal certified, and those are PFAS free. And we did come up together during our discussion with a proposal that as part of the procurement process, we include language in all municipal purchasing documents to request PFAS-free products. And Barnstable has done this. So we had a few other recommendations for town departments that we've so far thought of. This is still all in process. One is for Brookline to work with other towns in making purchasing decisions that include evaluation of PFAS and products, because obviously the more towns are requiring this, the more likely that manufacturers will be accommodating us. As noted before, there's still no approved PPE for firefighters, but there is a new standard that is being considered, and the town should be monitoring this and then switching to non-PFAS free firefighter PPE, though that will also be we'll need the funding for that. We need to confirm that all departments are using Green Seal certified products for cleaning. It's also a new, there's a new standard for Green Seal certified. So it's possible that we're still using some products that were Green Seal certified under the old certification and not the new one. Under food services, we did wonder whether the uniforms contain PFAS, and that was something that Sasha was going to look into. And we also think it's generally important to provide more education of department heads and purchasing agents about PFAS. And with restrictions on sales, well, we're still struggling with that one. Currently, our thinking is that, or at least for some of us, that until better identification tools become available, which we think will become more likely once more states have actually implemented bans, and thus have better databases for towns to use, and given the very limited DPH enforcement staff, we're trying to think of possibly placing restrictions on the sale of a very few clearly identified products, but allow for additions to the list as identification of PFAS-free and PFAS-containing products become easier to do. Also, we think it's important to add staffing to DPH if needed to enforce PFAS regulations. And we want to see what kind of further education of consumers is possible. And also to educate local businesses about PFAS. And that's where we are right now. And we still have more time to work on this.
Great. Thank you so much for an excellent presentation, Alisa. And now we will go into questions. And please, as I said at the beginning of this talk, put your questions in the Q&A function on your computer. Thanks so much. We've made progress in Brookline, and I think this committee was important. There's a comment here. There's another company that destroys PFAS to help the firefighting foam and PFAS. It's located in Massachusetts, and there's a link in the chat if anybody's interested. Does someone have wait a minute. I don't have all of the questions that I am supposed to have in front of me. I know that there was a.
Yeah, Louise, if you scroll up, and maybe I can start with one, which we know is a hot topic, and hoping to get.
Go ahead.
Hoping to get Professor Heiger-Bernays' view on this, because we know it's a hot topic in town. And what are your thoughts on artificial turf and school playing fields? I think particularly with PFAS exposure. I knew that was coming.
I knew that was coming, right?
Right.
We're dealing with that in Lexington and in Arlington, right? And I'll get to the answer, but because this is about PFAS as well, right? The answer is these turf fields, these synthetic turf fields are made with, they're plastic. They're made with synthetic materials. They're made with materials that from a hazard perspective, we know are toxic, right? That's what we know. We don't have good data on exposure, but when we think about, put this in the context of PFAS, right? What we want to do is eliminate additional toxic chemicals because we're already carrying around a toxic chemical burden, right? And so what we don't want to do is add more. from a public health perspective, we always want kids and others outside playing, right? So that's what we want. But we want to also make sure that we consider the full alternative suite, right? This full suite of alternatives. We want to really investigate what it would take to have a organic turf field, right? We don't want to simply say, we can't afford it. We've always done artificial turf. We want to be playing all the time. It's a done deal. We have new data that is looking at all of the aspects of the artificial turf fields. That includes, that's that cradle to grave question.
Yes.
I worry that as our towns continue to purchase synthetic fields, we're going to be left with toxic, essentially a toxic mess. Nothing is getting safer, right? No regulatory authority has ever said, wait a minute, we made a mistake and that chemical is actually safer than we thought, right? It doesn't work that way. As our studies get better, as our methods get better, we know these are toxic, right? And so what we definitely want to do is to make sure that the full cost of the synthetic field is evaluated. It's not cheaper to have a synthetic field over time. So consider the full picture.
The externalities, we never like to do that though in economics in the United States. We have a question. How much do medical drug manufacturers know? How aware are they of this problem?
Well, so they have known that they are using carbon fluorine, right? Because remember, it doesn't break down. They don't want the drug to break down until it's eliminated from the body. So, there is a reason why the carbon fluorine bonds are in those pharmaceuticals, but it wasn't until we actually published this paper that representatives from pharmaceutical industries had started to call us and said, we were not aware of this thing called PFAS. So we know the FDA is not paying attention to this. And I think we're not recommending that pharmaceuticals be thrown out. We're asking again for substitution, for innovation, and for change.
Okay, excellent. Are there non-PFAS solutions for fires that occur in EVs and in lithium batteries?
I can't speak to the specific fire. I do know, though, that there are, even in Class B firefighting, fire foam requiring currently, that there are new formulations that the FAA has funded, that other firefighting organizations are funding to determine what those the efficacy of those firefighting foams. So that's in progress.
All right. Is it true that nail salon workers and hair salon workers have high exposure to PFAS?
No, I have not seen the evidence for that. Nail salon workers and hair salon workers have high exposure to phthalates and to other chemicals, but I have not seen the evidence for PFAS.
Okay. How does it help to read labels if there are so many of these chemicals and the industry is not obliged to identify them clearly?
Well, I think your other moderator, your other panelists spoke to that, right? Which is about the listing. Yeah.
I think one of the things that's most encouraging to everybody is that if we can pass this bill, the Senate and legislature bill that we have right now in Massachusetts, in a few years, we will have a database. The state has the resources to make sure that that actually happens.
May I make one comment with regard to that, Louise? Is that we have not yet spoken about the Toxics Use Reduction Act.
No, we haven't, and we should.
And I think it's important for us to recognize that we in this state have a law that no other state has, right? Which is that there is a law on the books to reduce and reduce toxic chemicals. And that law, right, integrates what DEP has to do, which is to follow up after the mess is out there and actually to track these chemicals in industries. And there are ways to decrease the amount that's of the chemical that's required for triggering the act. But I think we need to recognize that we have that tool and we have not used that to the best of our abilities.
That's a very interesting point. I did not know that. That's a good one for me to know more about. Thank you, Wendy. What about the Quabbin Reservoir, our source of drinking water? Is it safe from PFAS? And I want to add a little addendum to that. I was at Walden Pond yesterday, and for the first time in my life, I saw a warning sign that said, "Don't fish here because of PFAS." I've never seen that in all my years, and there it was. So what about Quabbin?
Quabbin, we do know that there has been fish collected and analyzed for Quabbin, and the PFAS that were analyzed are not elevated in the fish like they are in Walden Pond.
Yeah.
Water has been tested. It also does it. These are non-detects, but no one can say never, ever, or absolutely not.
So I just think that's important that the MWRA water that Brookline is supplied with is at the non-detect level. That doesn't mean it doesn't exist and there's no PFAS, but it's at a non-detect.
Well,
Yeah,
part of the problem is we don't yet have the technology that we need. If in fact the EPA standard of, what is it? Somebody help me, 0.04 parts per trillion. If that if that actually went into effect, everybody would have to get new technology to do that detection. Isn't that right, Wendy?
No, the piece it would be a detection limit actually of 3 parts per trillion, which is higher than what DEP requires now, which is 2 parts per trillion.
Parts per trillion. And the technology exists to detect at that level?
2 or 3? Yes.
Good, okay. Could we start by eliminating the sale of nonstick pans, which we know are PFAS, and maybe be sure restaurants aren't using them?
I'm going to defer to Alisa.
Well, that's the one I've been recommending, actually. Yeah, I don't know whether it's too restrictive to just do that. And in fact, I was wondering whether Dr. Heiger-Bernays had any recommendations for specific products that would be somewhat easier to enforce their bans. But that is certainly one that we've been thinking about, though I didn't think of having restaurants not make use of them. That's a good idea.
Yeah, I think it's a good one.
Yeah, and I think thinking about, restricting the product and really how do we get people to change products they're already using? There's a lot of those pans already out there in the community. And that's where we get into I think more about awareness and consumer choice. And I like Professor Heiger-Bernays said, sort of the joining of regulatory enforcement with consumer choice and those 2 avenues working together, I think is probably how we're going to reduce it the most.
And I also think if we think about the pan problem, right? The pan problem is not your exposure while you're cooking, right? The pan problem is the production of the PFAS in manufacture, the release to the environment, to the communities that are living around. And when you decide you're going to throw away your pan, where does it go? It goes either to the landfill or the incinerator, and then that PFAS is released.
Yeah, I think that's important for people to understand.
And focusing on, the primary exposure pathway is ingestion, right?
That's what we understand. There is an underestimate, we think, of the inhalation pathway. There is evidence that to date, it's ingestion, whether it's dust, whether it's in water or in food, but ingestion seems to be the major pathway.
That's interesting because that's the next question I was going to ask you. How does PFAS get into our bloodstream? Air, food, water?
Yes.
Yes. Good question.
Which is related to those recent fish advisories that you're seeing.
Yes.
Those are new because of testing that has been done where we have seen it in food product or in fish.
Can you provide more information about PFAS in medical devices? And is it a given that they will be absorbed by the body through this exposure?
So so medical devices, implanted medical devices
Yeah.
do contain, do have PFAS. We don't really want the medical devices to become gunked up or rusted, right, inside. And so we don't actually have data on whether there is release of the PFAS into the bloodstream. Those are studies that are ongoing now.
Okay. All right. I don't think we have any more questions. Do any more panelists have questions that they want to ask while we're still on? Or are we going to wrap up?
Well, I do want to still follow up on that question that I had for
Yes, go right, please.
Dr. Heiger-Bernays, just what low-hanging fruit would you recommend banning? Something that's feasible for sellers to be able to restrict and for DPH to enforce. Do you have any ideas on that?
Well, I'm actually of a similar mind to Sigalle, right? Which is, you're doing this education and it goes really far, honestly. And I think that when you start to ban things, I mean, it's useful to understand what you're asking, what the low-hanging fruit is. And I think that, low-hanging fruit might be things like dental floss, for example, right? You've identified that. But I think its awareness actually is very, very powerful. And I'm not sure that banning, even going back on what I've said, the dental floss is going to get us where we need to be. People are trying to figure out what we call the risk cup or the exposure cup. What is the relative contribution of different sources to our exposure, right? And it seems that, the water is enormous in communities that have, these high levels of contamination. And it seems as though food may actually be the next most significant contributor to human exposure. And so, I think about this a lot because I think about what we eat and how we can address this. And I'm very interested to see what Maine finds, right, as they really move forward on their food packaging and everything else, to see whether that makes a difference. So I think about this from the health piece, right, from the population piece. And without going on a rant, I do think that consumption piece is really a driver. So I almost think you got to jump in feet first rather than this product and then this product and then this product. Because I don't know, I think that just gets people annoyed as opposed to actually making change.
Interesting.
Can I have a follow-up question to that then?
Before the follow-up, can I insert a couple of questions
Sure.
that come through? And hopefully we'll have time for that. Is seafood sold at restaurants safe? Is the town able to spot check for PFAS contamination?
That's a Sigalle question. If you want me to help you with we can't test for it like that. There is no spot checking for PFAS in fish.
Okay.
It's more, we can do some general awareness once we know what types of products it is, but I don't think we have that answer yet. Type
Okay.
of food product it is.
Yeah. We now know, because the state of Massachusetts has told us, that there are certain lakes in which there are fish that are contaminated with PFAS and we should not eat them. But that's people going fishing. That's not when you go to buy food at Star Market.
Well, do we imagine, and this is a question for you, Wendy, about, in the future, will we know things like we know with mercury in certain types of fish?
Yeah.
Or PCBs, or, we know
Yeah.
the type of products that are in certain species.
Yes, in fact, there was the fish forum, the EPA fish forum was held about a month ago, and it was almost entirely on PFAS. And the data that were being reported, demonstrate the presence of elevated concentrations of PFAS in fish virtually across the entire country, right, in freshwater fish. We don't have the data yet for marine fish. There are data on farmed fish that are coming out of Norway, right? And fish are swimming in it, right? They're swimming in the water that contains the PFAS, and it's bioaccumulating. So I think that when we look across the US, we see that freshwater fish is contaminated like mercury in that it's regional, right? We have a ban in Massachusetts on all freshwater fish, actually an advisory for mercury. And I suspect over time, we're going to see the same for PFAS.
There are still questions. I'm sorry we can't get to all of them. And Alisa, we can't get to your follow-up because it's time to end our webinar. I want to thank all of you, particularly our keynote speaker, Dr. Wendy Heiger-Bernays. And Alisa, you made a terrific contribution with what Brookline as a town is doing to confront this. And Sigalle, thank you. It's been excellent for Mothers Out Front to collaborate with the Department of Public Health on this important issue. And stay tuned. We may be asking for your help to advocate for a really strong PFAS bill this session of the legislature in Massachusetts. So thank you very much and good night, everyone.
Thank you.
Thank you. Good night.